Hello, 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 hello. Just waiting for folks to log on. This is Dr. Hassan. This is the Rehab Roundup. Uh, Once again, coming to you Tuesday at 7 p.m. Welcome, 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 welcome. Just always waiting for folks to come on before we kind of get started. Like to give people a couple minutes to kind of log on, sit down, have a seat, and get ready for the knowledge that's being dropped during the Rehab Roundup. Hopefully everybody's having a good day. I think I always talk about the weather here. Today was like 109, so I think consistently over the past few shows it's been 100 plus. Today is 109. I know driving into work when I got out the car, walking into the building, it was super hot. But thankfully, in the evenings, it does cool down a little bit. So I'm definitely looking forward to, I think like October. That's when the weather really kind of hits that sweet spot where we're in the 80s. And it definitely feels like paradise. So looking forward to October for multiple reasons. Dr. Ken, thank you for joining. For multiple reasons, because hopefully by then the pandemic will be in a different position. But right now, it is definitely tough. So thank you everybody for joining in. Dr. Mashika, thank you for joining in. Just waiting for a couple more people to join in before we kind of get started and talk about our topic today. Today's topic is kind of an expansion on what we talked about last week, so I think it'll be cool. What sweet spot? Sweet spot where it's not too hot, it's not too cold, and the weather's just perfect. You know, like the Caribbean. You know a sweet spot. The Caribbean, man. You come from the sweet spot. So that's what I'm looking forward to in October out here. And that lasts for about, I think like 4 or 5 months. So it's great. Yeah, it's definitely cool. Very different coming from Chicago where, you know, the winter is like 6 months. That was a reason why I said, you know what, I got to get out of there. Love the city, but it's tough during the winter. So let's see. I say we'll give it about 2 more minutes and then we'll get into the topic. But I definitely appreciate everybody for joining me and listening to me talk about my passion, rehab. It's definitely something I love and something that's needed, you know. We all get sick, and when we get sick, you know, we need some rehab sometimes. Red Rocks in Tucson, yes, they're nice. I hear a lot about them. Haven't been there yet, but I plan to go there soon. Definitely on my list once I get a little more time, and I think that's coming. So I'm excited about that piece of it, getting a little more time and being able to enjoy Arizona. Maybe hike a little bit. Not a huge hiker, but you know, I'll try it once, kind of see how it goes. But yeah, I'm excited, man. I'm excited. Hopefully people are getting value from the Rehab Roundup and me talking about all things the business of rehab, really how to start your practice, grow your practice, different strategies around that. Because it's important, you know, and it's not something that they teach you, and it can really impact your revenue, your lifestyle, and your future, you know, because while you're in those high earning potential years, you really want to maximize that so you can plan for the future, put money away in your retirement fund, build and grow that with that compound interest. So it's really important to really make best use of those years and that time by building your practice. So, all right, 7:05. So, welcome to the Rehab Roundup. I'm your host, Dr. Hassan, board certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Today we will be talking about start with the students, Last week it was PTOT and speech. This week is going to be nursing. So really focusing in on educating and talking to the different nursing schools. So couple housekeeping items. That's what they say, right? Housekeeping items. Please share this with any physiatrist or anybody you feel will benefit from this topic, and definitely tag someone who you think will benefit from this as well. So we'll just go ahead and get into it. Start with the students, the nursing students. So if you think about it, there are 996 baccalaureate nursing programs in the U.S. So what that says to me is there are a lot of potential touch points in terms of being able to interact with someone who can potentially help drive patients or get you involved in care to help you grow your business. So one of the ways you can really get access to or find out about the different nursing schools in your particular area is to go to the American Association of Colleges of Nursing. What you do is you Google that, go to the website, and basically put in your city and state, and that'll give you a list of the different nursing programs that are in your vicinity. Once you have that information, what you want to do is you can either call, email, or go in person. I really like in person because it's a different feel. You get to have that face-to-face contact and really develop a relationship. So go to the nursing school and really try and find out who's in charge of education or the curriculum. And just like we talked about last week, you basically pitch to them like, hey, I'm a local physiatrist, just looking to see if you guys have any holes or areas in your curriculum where you may have the potential to have me speak on what I do from a physiatry standpoint, and how we function in the healthcare system and how we work with nurses. They may have an opening. If not, they may be able to put you on the schedule for that next semester or what have you. But when you do that, that allows you a platform to talk to student nurses. And this is great because you're introducing yourself to a key component of the healthcare system. I'm pretty sure I've talked about this on other episodes of the Rehab Roundup. Nurses are hugely important. Dr. Jaquel, thank you for joining in. So yeah, they're hugely important in the healthcare system. They spend anywhere from 8 to 12 hours at the bedside with the patient, going over medications, monitoring vital signs, going over the plan of care with other specialists if they're involved on the case, educating patients on their particular disease process, and just overall advocating for the patient. So this is someone who you want to develop a relationship, but also explain to them your role and your function in the healthcare system, so that when the time comes about, they can really advocate for you, but they also understand what you do. I think one of the biggest gaps in the healthcare system is not really knowing what happens once you leave the acute care hospital and all the different options that you have available. I know the post-acute care space is kind of a black box. So talking to them about the different levels of care, so your acute rehab, how that differs from skilled nursing facilities, how that differs from long-term acute care hospitals, how that differs from home health and outpatient, how they all interconnect, and really how to get patients to each particular level of care. You want to talk about how their documentation can help in terms of documenting certain rehab-related issues. I know one thing we look for, or a diagnosis that can be helpful, is metabolic encephalopathy. So if you have a patient who comes into the hospital, if they can document that in their notes, that's going to be helpful in terms of transitioning a patient to acute rehab level of care. So, just giving them really key tips and points on what they do, how they do it, and how they document it, and how that's going to be helpful for the patients is going to be important. You definitely want to talk about outcomes, how certain diagnoses, and just in general, being able to go to a facility that has that intensive rehab is really going to help that patient from an outcome standpoint in terms of getting as close as possible to their prior level of function and getting back home. And that's with your more mature adults. That's what I like to call them, more mature adults. But also for your young patients. Right now we're seeing a lot of these COVID recovery patients, and they're having some significant pulmonary issues, and they can benefit from going to acute rehab, getting that intensive therapy. And some of them can be really short stays, anywhere from like 7 to 10 days, getting better and then getting back home. So you definitely want to highlight the outcomes. Like we talked about, you want to talk about the different patient populations. You have 60% of patients that fall within a particular diagnosis. Then you have 40% that fall within another diagnosis. But, there's certain patient populations where it's really a slam dunk getting them into acute rehab. The American Heart Association and American Stroke Association recommend acute rehab level of care for, most stroke patients. So that's definitely a patient population that you can talk to them about and really explain how transitioning to acute rehab, having a physiatrist on board, how we interact with the interdisciplinary team, really helping a patient, how that's going to help them achieve really good outcomes, but also minimize any functional deficits that they may have from that stroke. So that's going to be important. I think a point of confusion sometimes for folks in healthcare, nurses, and other individuals is the 3 hours of therapy. You want to explain that, listen, this is not, like we talked about before, lifting heavy weights, Taibo, or anything like that. It's really functional things like upper extremity dressing, lower extremity dressing, bathing, toileting, transfers, all these different functional things that we take for granted when we're healthy, that when we have some type of medical issue, we're no longer able to do that. So these are the functional things that we're addressing, helping them get better so that they can safely transition back home. You want to talk to them about the team approach in rehab. Rehab is really a team sport. Like, you have to have everybody on the same page. And nursing, again, plays a very important role in that because they're managing the patient's bowels, the patient's bladder, surgical wounds if they have that. They're making sure that, they don't have any complications from whatever medical event occurred, bringing them into the acute rehab, watching the vital signs, administering medications, IV, antibiotics, tube feeds, all these different things to really put the patient in the most optimal position to be able to get through their therapy, get better, and get back home. So you definitely want to talk to them about the team. You want to explain to them how, when they actually finish with nursing school and they're on the floor, how they can consult you and get you involved. That's going to be important. You want to talk to them about how they can really help with discharge planning and disposition by interacting with the discharge planners or the case managers and helping them to determine what's the best place for the patient to go once they leave the acute care hospital. So that advocacy role is important. You want to explain the different common goals. Most nurses go into the field because they want to help patients. Physiatrists go into the field because they want to help patients. So explaining how we have the same goal and how we can work together to get really positive results is going to be important. And really overall, just explaining what a physiatrist is and what we do. I think doing all these things will go a long way in terms of introducing you, the field, the different levels of care to a very key component of the healthcare system, which I think in the short term, intermediate, and long term is really going to help everybody. So it's really a savvy way to get your name out there, get more exposure to the field. Really start from a grassroots approach in terms of teaching folks who are eventually going to be in positions to kind of get you involved and help patients out that way. So teaching starting with the students is going to be really important in terms of how to grow your practice, really educate about the field in general. So I thought that would be a key or a really good thing to talk about today. So I appreciate everybody for logging on. This is Rehab Roundup. I'm your host, Dr. Hassan, board certified physiatrist and independent practice owner. I help physiatrists start and grow their own independent practice so that they can achieve financial independence and live without limits. Next week, I think we're going to talk about how to be efficient in your practice. That's going to be important because time is money. So the more efficient you can be with your time, the better impact you can have financially, because you're really getting the biggest bang for your buck and doing it in the least amount of time. So more time equals more freedom. So that's going to be important. I look forward to everybody tuning in next week where we talk about some ways to be efficient in your practice like we talked about before. Please share this with other physiatrists or anybody else who you feel may benefit from this knowledge. I definitely position myself as a guide for other physiatrists to help them build and grow their practice, because I understand, I've been in that position, coming right out of residency, not really knowing what options I have available to me, and thankfully, I didn't have to make huge mistakes that impacted me financially. I was able to move into a practice and really maximize my revenue during that time. So I really want to function as a guide to help other physiatrists kind of reach that position, because I understand the pain. So I want to eliminate pain, right? That's going to be important. So thank you, everyone, and look forward to seeing you next Tuesday at 7 p.m. Have a good night. Be safe.